The people that aren't doing well in receiving the treatments are those who are more frail. So the research that I'm doing now is to work with oncologists on developing prehabilitation programs for people about to embark on a chemotherapy or cancer surgery, because if they go into these operations stronger, having built some strength and balance, we know that they're going to do well. My name is Dr Rik Dawson. I'm a Gerontological Physiotherapist, a Postdoctoral Researcher at the Institute for Musculoskeletal Health at the University of Sydney. My research focus is on older people. How do we support older people to extend their healthy ageing lifespan by improving their ability to walk, reducing their falls risk, but also introducing the concept of exercise for life. So the main focus of my research is telephysiotherapy. So in 2021, I enrolled in a PhD, and my thesis topic was, can we deliver telephysiotherapy to older people receiving aged care services throughout Australia? That's in residential aged care or long-term care, and also in home support. And the great thing about this research, I had the benefit to work with some aged care partners that as a clinician I'd been working with for over 20 years. So we developed a model of care where they would receive physiotherapy over Zoom once a month. They would receive an access to a website called the Top Up website, where there are a series of strength and balance exercise videos that my mum and I produced that start at 10 minutes and go up to an hour, increasing in their challenge. And the physios would recommend what program they would start with, and our aged care partners provided them with once a week support by a trained care worker to give them the confidence to do the exercises, follow the videos, and engage for exercise over the 6-month trial. The trial finished in 2024, and in 2025 we published our results in the Medical Journal of Australia, and telephysiotherapy was shown to reduce the proportion of people falling, the amount of people falling, by 38%. It also improved their mobility, reduced their pain, and it did deliver the quality of life enhancements that we were looking for. But importantly, we did a qualitative analysis, and what that showed is that older people did enjoy and utilise telehealth, but they needed that local support. So it's been it's been an exciting opportunity for me to take my clinical practice into the research world. I'm also the National President of the Australian Physiotherapy Association. My principal role is to represent 36,000 physiotherapy clinicians and students across Australia, and at the moment we know that the challenging issues that we have around our ageing society, the impact that that's going to have on our health system, and the cost of being able to provide the services to this older population as we get older. The Australian Physiotherapy Association is unique in that it delivers a career pathway that ultimately leads physiotherapists to become specialists in their clinical area. And it's a phased approach, and there is a step on the way, and it's called titling, where after 5 years of working in an area, so for me, that was working in aged care with older people, I was able to submit a portfolio of my education, submit a video of my assessment and treatment of older people, and receive a title to be called an APA titled Gerontological Physiotherapist. I did that after about 15 years of working as a clinician, and what it did, it introduced me to the latest evidence around older people, ageing and gerontology, and it got me start to think that we need more research into older people, particularly as the world is evolving in technology, and so it really made me think about what next for me, and that was to do a PhD. 50% of people who go into hospital are older. They're aged over 65. And increasingly, we're seeing in areas like oncology and orthopedic surgery and in the field of geriatrics that The people that aren't doing well in receiving the treatments are those who are more frail. So the research that I'm doing now is to work with oncologists on developing prehabilitation programs for people about to embark on a chemotherapy or cancer surgery, because if they go into these operations stronger, having built some strength and balance, we know that they're going to do well. So we're doing some research at the Chris O'Brien Lifehouse at the Royal Prince Alfred Hospital in Sydney. I'm also looking at, in Australia, we have approximately 1 in 3 households that English is not their primary language. They've migrated from other countries, and our healthcare resources are predominantly English. So I was fortunate to be granted with my boss, Professor Sherrington, from an Australian Research Council to take top up and develop Chinese language, Italian language, Arabic and Vietnamese, so that people from those communities have access to evidence-based resources to improve their mobility and reduce their falls. I was fortunate during my PhD to get funded by Dementia Australia, which enabled me to include people that had some memory problems or were diagnosed with dementia to be a part of my trial. I was also funded by the Australian government through a technology grant, because the Australian government is really excited about the opportunities that telehealth and digital health is going to have to open up access to all Australians to healthcare. I'm a member of the Falls Alliance, which is a collaboration of academics, clinicians, service providers, but importantly people with lived experience, to really focus some advocacy messages to government about the need to provide more resources for people to prevent falls, to maintain their mobility and to age well. So it's been a really exciting initiative. I'm also a member of the Cardiovascular Alliance, because it's really important that cardiovascular disease is not just a medical and nursing approach. It takes the village of interdisciplinary approach, physiotherapists, occupational therapists, exercise physiologists, to give them the best quality of life once they're being diagnosed with a cardiovascular disease. I've always been interested in talking to people, and I love also giving people opportunities to be their best selves. And I actually fell into working in aged care. It wasn't a conscious decision to go and work into aged care, but I just noticed that a small intervention or a small bit of advice from me as a physiotherapist could have a remarkable change in a person's ability to navigate their daily life, to be able to leave their home confidently and to walk to social events and family events. So I really enjoy the holistic approach to looking after an older person and opening up their eyes to the potential of what they can achieve as an older person. I'm a yoga instructor. My mum was a yogi, and so I've spent a lot of time on the mat working on my strength and flexibility, and I found it a really great way to stay fit and stay well, not just physically but mentally. I'm also an opera singer. In my 20s, I went and did my opera training at one of the universities, and I've spent the last 15, 20 years doing very small roles and working with a little local company called Opera Bites, doing what we call pub opera. I just love the feeling that you get with full voice and being able to entertain the people on a stage.